Thank you for joining us for this episode. Today we're joined by Chelseys Background, and we're going to be speaking about the dirty side of contact lens solutions on the 𝘼𝙗𝙚𝙪 show. Thanks again for joining us for this episode. Today we're joined by Chelseys Background. How are you today, my friend?
Doing really well. Thank you for having me. I'm excited to be.
Absolutely. So, Chelsey, you are not a brand new grad, but a recent grad. Tell us a little bit about you and what you're doing. I see ICO in the background there. You must have an affiliation of some sort.
Yeah, so I am currently faculty at ICO, mostly within the cornea contact lens anterior segment section, a little bit of primary care and other things thrown in here and there. But I went to Berkeley for optometry school, and then after I graduated Berkeley, I decided to stay there to do my cornea contact lens residency. And I had grown up in the Bay Area literally my entire life. Grew up there, went to undergrad there, stayed at Berkeley for all the opto stuff, and I decided it was time for a big change. And I had met the crew at ICO at various national conferences, things like that, and I really love the people that are at ICO. So that's what drove me there, and I'm very happy in my position. I'm mostly in cornea clinic, like I said, but also right now I'm teaching the anterior seg course for winter course.
So Chelsey and I met in a poster section at the academy, and we kind of had been dealing with some other issues within optometry schools that I deal with, and one of the things that I was kind of interested in is we're not talking about contact lens solutions very much anymore. But as many of you know, in 2006, 2007, we had an 𝘾𝙚𝙚𝙬𝙯 and a Fusarium outbreak, and contact lens solutions were removed from the market. Those days were the contact lens solution wars, and all the major companies were fighting over whether their solution was the best. Now, it has been nearly a decade since many of us have talked about contact lens solutions, but yet still 40, 50, 60%, depending on the study that you look at, of all contact lens wearers, soft, are utilizing a contact lens solution, and we're not talking about it at all. And that means that doctors are probably not thinking about them when it comes to their patient care. So you took on, along with both Dr. Lindsay Six and Andrew Pucker, both who have been on the 𝘼𝙗𝙚 show, a major undertaking. Tell us about the genesis of this work that you put in to give us an update on contact lens solutions. How did this come about?
Yeah, absolutely. So, like you said, Lindsay and Andrew were with me on this, and amazing mentors. And really, they were the ones who, at the get-go, kind of realized the gap in the research recently, and just noticed that there wasn't a great summary of where we stand right now compared to where we stood in the past, and new products, things like that. So they decided that we should make a review on it for, it's not a comprehensive literature review, but it's pretty extensive. And they were kind enough to invite me on that. And I agreed once I dug a little deeper. I agree with you. I agreed with them. Nobody's talked about this for a while. And I think it would be refreshing to have one resource to go back and find all the information in one spot. That was our goal.
Maybe not fully comprehensive, but I think 88 references is pretty substantial.
That's true.
So in contact lens solutions, I think the biggest beast that we're dealing with is the preservative aspect of this, and we have to have the preservative to some degree. And so tell us a little bit about kind of what you learned, or what are some things that really kind of stood out to you that maybe you don't remember from optometry school, or haven't remembered from residency and so forth, that really kind of stood out.
Sure. I'm glad you brought that up, because I think, in optometry schools, sometimes we get taught these are the big ones that people use now. So they work well. If they get some sort of allergic or toxic response, just switch them to a hydrogen peroxide solution and unfortunately, sometimes that's all you get or all you remember because you're so overwhelmed with other information.
Yeah.
So I can't say I remembered exactly which preservatives were in which solutions before this paper. So I think it's useful to, my favorite part of this paper is the table that is produced in there that's saying which preservatives are in which solutions, because I think it's a nice quick reference to go remember. And then when your patient has specific risk factors for certain infections, like exposing their soft contact lenses to water, you need to know what's effective against 𝘾𝙚𝙬𝙗 versus
Right.
just general bacteria. So that's what I took out of this: specific preservatives that are in specific solutions and how you might need to adjust based on your specific patients.
Mm-hmm. What are some of these major preservatives,
Yeah.
and how do they differ, or why would you switch from one to another? How
Mhm.
does that work clinically?
Sure. So the two major ones that are in all the solutions right now are polyquaternium 1, which goes by PQ1 usually, and then PHMB, which encompasses quite a few similar compounds that are all under that umbrella. And those are the ones found in the, OptiFree, BioTrue, a lot of the common ones used today. And I find clinically with my students and when I was in school, someone's having an adverse reaction to a solution and they know that those are the most common ones used or the ones they've heard the name the most, if anything. So they're saying, okay, their OptiFree is not working well, let's switch them to BioTrue. But they're not going to realize maybe that BioTrue has the same preservatives in it that OptiFree does sometimes. So
Yeah.
clinically, it's important to make sure you're not switching your patient to something that's not even going to help the problem.
Mm-hmm. Yeah. So if you switch from, say the patient has a PHMB and you switch from one PHMB to another PHMB, you're not really doing anything. So there obviously are some advantages to multi-purpose solutions. You don't have to have the 6-hour disinfectant that you would have with the peroxide for it to kind of calm down. If a patient drops their contact lens, you can pick it up and kind of rinse it off. It's kind of one of those benefits. So there certainly are advantages to multi-purpose solutions. So knowing where they fit is still an important thing. What about generic solutions? Did you dig into the generic world of solutions at all?
I really didn't. And we, Lindsay and Andrew and I discussed it and we decided not to because clinically we rarely recommend patients go in generic. If they've already done it on their own, we can consider if they're doing okay, letting them leave it. But we just didn't feel
Mhm.
it was best practices to recommend a generic when you don't know exactly what's
Yeah,
in
no, I
it.
think that's sound advice. The vast majority of our patients are going to the supermarket and selecting a generic solution if it hasn't been recommended to them. And that's just a key component, is these patients are spending a considerable amount of money on contact lenses. And we really need to tell them what kind of care system. I mean, you don't sell somebody a car and then tell them they should figure out whether it's gas or diesel or what goes in it, or that they need an oil change, right? You need to tell them how to care and handle it. And I think the generic solutions historically have been older solutions, the technology that's not as good. They may not have as good of wetting agents. They may not have as good of those sort of things. And some of them may have some preservatives that we're not really all that comfortable with our patients being in. So now let's talk about the dirty side of contact lens solutions. Like, what are some of the things that you kind of discovered are common side effects of these preservatives?
Sure. So definitely contributions to the discomfort of the lens, whether that be from things that cause dryness, but mostly just disruption to the ocular surface, both
Yeah.
conjunctival cells and corneal cells. And it is somewhat controversial. Some of the studies found there's no significant correlation between the preservatives and stain, and then some of them found quite a bit of a correlation. So you've got to, consider the studies themselves and how they were run. But I think it's obvious if you have a patient in front of you where they've got pan corneal staining and conj staining, and their only risk factor is that they're using a preserved solution, it's obvious enough that you need to consider switching to a different preservative
Yeah.
because that's likely the culprit.
Right, right. So, now asking you clinically, so I don't know that you necessarily covered this in this comprehensive review per se, but where do you stand with solutions? Is it something where you just out of the box, everybody goes to a multi-purpose or everybody goes to a peroxide, or how should we be, directing clinicians to be thinking about solutions that they're picking?
I will say that I generally go to a multi-purpose first for my soft contact lens patients. So that is, we didn't cover any specialty hard lenses in this
Right,
paper. I do
right.
differently for that for sure. But for
Yeah.
soft contact lenses for the average patient, I do go multi-purpose, and that may be partially where I practice. My patients are very upfront about the fact that they want the most simple solution. So if they're not in a daily disposable, they make it clear they want to have a system that's the easiest to take care of it. They can use all the ways that you would need to use a solution at once. And when they hear about neutralizing a preservative-free hydrogen peroxide solution overnight, quite a few of them, more than I would have realized before I started practicing, say they don't get 6 hours a night to neutralize something like that. We start with a preservative, but then I monitor, especially if they're brand new contact lens wearers, and make sure that they're not having discomfort, ocular surface problems, obviously. But I usually out the gate go multi-purpose, to be honest.
Yeah, yeah. Well, I think it's a key component that we need to be revisiting with our contact lens patients if they're not in a daily is what is the solution that we're recommending they use. In many cases, I think hydrogen peroxide is a good way to go, but when that patient needs a simplified solution, we need to make sure we're specifically recommending something for them and guiding them in the direction. And there are big differences, right? So wetting agents play a big part into the comfort. The preservative obviously plays a big part into the comfort. And I think it's just something we've gone by the wayside in our strong recommendations, across our industry in recommending to patients.
Yep, I agree. And I will say, when I do find something that I think the multi-purpose solution is affecting them, I go straight to a hydrogen peroxide. I don't try and change them to a different preservative because the likeliness that they're just sensitive in general is relatively high. And then
Yeah.
if I have evidence, well, it's time to go to a preservative-free alternative.
Yeah, and on that side, on the sensitivity, you're not going to always see that right away, right? So that's the other thing, is that sometimes a patient may have been in the solution and been using the same solution for years and years and years, and then they start to develop some sensitivities.
Definitely the delayed hypersensitivities for sure.
Yeah. Yeah, and that just baffles the patient because they've been using it forever, and then you tell them. So, well, I think some key aspects here, some really interesting stuff. Thanks for reading 88 papers and summarizing them into a short publication for us to read. If you have an interest in reading this publication, it's readily available. You can search for Chelsey's name, Chelsey Bradley, Lindsay Six, Andrew Pucker, and be able to find this publication. So thanks for hanging out with us on the OI show, and appreciate your work.
I appreciate you. Thanks for talking with me.
Absolutely. And thank you for joining us for this episode of the Optometric Insights Show. Please like and subscribe so you can stay tuned for other amazing episodes like this one with Dr. Bradley. Have a good day.